Hi, Pravina. Thanks for doing this conversation. The reason we're doing is simple. We just wrapped a 6 month long epilepsy support group batch, saw great feedback. I remember almost after every session, the WhatsApp group would be buzzing with energy, and we don't want to lose sight of what went into it. So, everything, right from the thought process, the vision, the structure, the challenges. So, we want to do this for our internal documentation as well as to be able to share it with a larger community. Uh, Anybody who cares about mental health, chronic conditions, and epilepsy.
Hi, Mike. Let's get started.
Great. So we'll start with, I think there's no doubt that epilepsy support group will be valuable. It's a chronic condition that impacts daily life. But when you actually sat down to design this group, what were the key factors considered on how to structure it?
So, Meg, before we designed our 6 month long program, we had done 10 plus batches of our limited sessions epilepsy group. And we had 3, 4 major learnings that we carried from there. One, of course, was the duration of the group. So before this, like a lot of other groups on Solab, our epilepsy group was only 4 or 6 sessions long, with weekly sessions being conducted. And we understood very quickly after we closed a few batches that, of course, support was available. But what did the user have at the end of these 6 sessions? So with a chronic condition like epilepsy, which for most people is lifelong, it that couldn't be the end of it. Even if we were bringing them to a WhatsApp group, there had to be more long-term support available. So that was one key thing that we knew we wanted to do. We wanted to make it a long-running program. And this was unprecedented even for us at Solab. We had not run a long-running group for any of our groups. And this was going to be absolutely new. But given the nature of the condition, we were absolutely sure that we wanted to do this with epilepsy. The other thing I think was the cost involved. So epilepsy again was priced very similarly to a lot of other groups. And with epilepsy, after we reached out to so many people, spoke to so many who did or did not end up joining the group, we understood that this is rampant in lower socioeconomic condition strata. So we knew that we had a lot of people who needed support but were probably unable to pay for it. So that was one barrier that we had to get rid of. So lowering cost was an obvious answer when we were designing this group. And the third maybe was the nature of the program. Before this, again, we had done very epilepsy focused groups where we had a therapist facilitating sessions and dealing with relevant themes for people with epilepsy, but it was limited to that. And we understood that we wanted a more well-rounded program because for people with epilepsy, it has to also serve, there need to also be solutions for practical issues that they face on a daily level. It cannot be limited to their emotional challenges. There needed to be some level of medical guidance available. So we thought of including all of that into our 6 month program. So these were the top 2, 3 things I think that we kept in mind when we were designing our program. Of course, relevance and safety was a huge concern, epilepsy being a condition with high social stigma in India. So that was something that we knew we had to keep in mind. But yeah, these are the 3 things I think that we were very sure of when we first started to design the 6 month program.
No, that is very interesting. I still remember. So we have for almost what 100 plus support groups at Zola, and like we follow quite a standard structure in terms of where most of these groups are 4 and 6 session groups, and the pricing for these groups are 500 per session for the end user. And when you came and proposed that we need something very different for epilepsy, where I think we went to what a 6 month long duration, and the pricing was 1,000 rupee for the 6 month long program. It
Yeah.
was like 100% something that required some convincing from your end on why it would make sense for us to do. But after the feedback, after the results, the renewals, like all of it makes so much sense now.
Right. I mean, at the face of it, it was, of course, not the best business decision to make, but it seemed very compelling at that time. So, I mean, yeah, good that we went ahead with it.
Yeah, yeah. which brings to us to our next question, which you also mentioned, right? Like we reach out to a lot of users to find participants for this program, and despite lowering the barriers where we increased the duration, made it long term, made the fee very, very affordable, what
Hmm.
was your experience of putting together the group? How did we what was the journey of finding participants who signed up for this program?
So I think, Meg, to put it very honestly, it was very, very hard. And the fact that we were doing it for epilepsy made it even harder. So this kind of information is not readily available, especially when it comes to Indians. If you log into any social media platforms, you will find tons of foreigners who publicly display on their profiles that they live with a certain something. But that's definitely not the case in India, more so with epilepsy, where people try their best to keep this under wraps. So discovery was a huge issue. We reached out to tons of people on Instagram. That was one of our, I think, primary sources. Ended up even building an all exclusive Instagram handle for people with epilepsy. So we had one for Solap and everything that Solap does, and one handle especially dedicated to epilepsy, which was again a very radical decision that we took. It just like something that came to us one day, and we thought that why have we not tried this? And that actually served very well, because we ended up discovering so many people once they realized that this was a dedicated space for epilepsy. So Instagram was one. Of course, talking to other people on LinkedIn, we approached 800 plus neurologists in our network.
Wow.
Some of these were people who knew of and trusted Solap. There were so many others who, of course, didn't know who we were, and we spoke to all of them, sent out messages, told them about our program, and asked for them to refer to us, and also reached out to all existing offline communities in India. So there's Saman, there's the Indian Epilepsy Organization. There were others. So we spoke to their handlers, and then of course word of mouth. So some of the participants for the first batch came through doctors that we knew, and patients that we knew who referred it to other friends in their networks. There were influencers who we spoke to, and they put it out in their networks. So I mean, it was a mixed bag, but yeah, a very, I think, uphill task, and the outreach was tremendous. There was so much cold messaging and calling involved. That is what got us there eventually.
Wow, I also remember that at some point you sent me to a hospital, neuro hospital near my house to put up like physical posters in the hospital for us to be able to discover more epilepsy patients. So it was like all hands on deck kind of effort.
Absolutely. We tried everything we had, and with epilepsy is like slightly closer to home for me, with my husband being an epilepsy surgeon. So tried everything, spoke to everybody in his network, all their patients, and just tried to make sure that we had enough. We actually started at a much smaller number than we had aimed for, but it turned out to be a great group.
That's brilliant. So Pravina, after wrapping this batch, right, after wrapping 6 months of this program, what do you think were key challenges and also surprises? Like, something that you expected to go a certain way, but was surprised by how things turned out, the feedback we got, etc. So, what were some of the challenges and surprises on this journey?
So, I mean, I already spoke about discoverability. That was obviously a very big challenge with epilepsy. And I think um, outside of that, one big issue was that people didn't understand what a support group was. With epilepsy or any other chronic condition, when I first started talking to people, uh, these were long conversations that I had, each of them being 30-45 minutes long, where I was found myself talking about the structure of a support group, why we need a therapist in that space, what could you possibly learn from other people in that space. So I mean, these are people who have never heard of a support group. It's only harder when you talk about emotional support for a chronic physical health issue. It's already so, I mean, very little is understood, right, about support groups in India. And then when you're talking about epilepsy and they think that we have another 100 challenges, is there a need for emotional support? They're not even like aware to the extent that they would understand that this could help. That others, talking to others who would say that, I've been there, I understand your fears, your daily frustrations, this is how I'm dealing with it, that could actually be useful. So that was a huge part of the conversations I was having, and
Till
explaining what is
you,
support for.
I guess, till you taste it, it's very difficult to visualize how it can help.
These are the same people, Meg, who came back eventually telling me that my life changed. And I have screen grabs of this where people have said, I have become a different person. Pravina, I cannot believe that you had to actually convince me to join one of these, and how my life has changed after that. So, I mean, yeah, but that was an uphill task. And making people understand that this was possible, that this could actually change how the outcome of your condition, your everyday life, your entire quality of life. I mean, that I think was the toughest part. Outside of that, the cost, I mentioned cost, and we subsidized it significantly, and yet I found that people were not willing to pay up because they didn't understand what they were paying for. So I think even that 1,000 rupees for a 6-month long program became a very, very big ask for most people.
Hmm. No, fair enough. Like, just talking to you right now is giving me goosebumps. So,
Yeah, but I think it was very rewarding, Meg. Once you actually convince somebody that give this a try, and they got in, and since it was a long running program, that was the surprise. Actually, I think that I would say that was how well people connected with each other and how quickly that happened. I mean, we could foresee that it would happen somewhere down the line, but like I said, we had not run long running groups before that, so we didn't know the depth of connections that people would build. And with people with epilepsy, there were people who for decades had never run into another person with epilepsy, and for them to suddenly be in a room where there are 10 other people voicing the same fears that you have, talking about the same frustrations, it was an absolute game changer for them. So I mean, yeah, I don't think there was a downside of this was just, it turned out the way we had imagined. Long running was the way to go. It still is for every other chronic condition, I would say, because over time is when a lot of it became organic. The groups just sustained itself.
makes so much of sense. Like, in retrospect, it makes so much of sense. But yeah, I remember like we had to take that leap when we took that decision to set it up for the first time.
Yeah, I
So,
think there, but some, I mean, outside of participants, there were also challenges that we faced with the facilitators, because this is not expertise that is readily available if you go
true.
looking. So finding facilitators who were passionate enough to do this, because there was definitely a lack of people who had expertise with this. So just somebody who was ready to, give it all and commit, was enthused about this opportunity, that was also very hard, and it was a long running program, so we needed somebody who was going to be all in with us and help us, co-build. So that was another big challenge, I would say.
Got it. Got it. And what next? So, like, we've wrapped up a 6 month long support program. What is the vision? Like, what is the long term vision here? And what are our plans when it comes to next stage of this program?
So I mean, we are headed in the right direction, that's for sure. I think just more of what we have been doing, lowering costs further, because we know that's a big barrier in India. Scale has to grow. It Success to me would be where this would become a go-to space for anybody diagnosed with epilepsy in India. This should become part of standard care. We don't think of emotional support as something that is imperative, but that is when I would say that we've succeeded, that people think of emotional support as part and parcel of the entire, treatment plan. It cannot be an option. That, and I think, yes, making it accessible for anybody who needs it. Sola epilepsy support group, and I know we are the only one running it right now. That needs to be an obvious answer for everybody who is diagnosed with epilepsy. So I think, yeah, that's the vision. We of course want to try it with other chronic conditions as well. So that's going to be there as well. But yeah, making it like a long running program with where the patient doesn't pay out of their pocket is, I think, the dream.
Mm. So you're saying if you were if you probably had unlimited resources,
Yeah.
that's the way you'd go about.
Absolutely, absolutely. We know patients are, as it is, paying a lot for treatment. Treatment costs are high in India. Medicines are not accessible. So, of course, paying for an additional layer of support is hard for most people. And if you want to build it at the scale where it's accessible for everybody, cost is going to become a barrier, and we'll have to find a way around it. So, that's definitely one.
Got it. Got it. This was very, very interesting and insightful to understand, Pravina, especially like, the smaller or I'd say the specific incidents you mentioned in terms of how you set it up. Uh, and I'm hoping that we set up a more robust long-term program as we proceed in this direction. Is there anything else you'd like to share? Any parting thoughts, or if anybody else is looking to set up a support ecosystem for a chronic condition in India, like any key learnings that you'd like to share?
I think in terms of learning, Meg, since it was our first time building a space like this, uh, I know for a fact that I over prepped in terms of what the agenda would be. We tried to mix it up in terms of what therapy approach we'll take. Let's make it interesting for the participants. This is the agenda we're going to stick to. This is session one. This is session two. I over planned. And once the group was on its way 4 5 sessions down the line, I think it became so organic that very little was left for us to dictate. The participants knew what they wanted out of the group, and like you said, each session they came back saying that this is probably one of the best sessions they had. So I would say leave a lot of space for organic sharing, because most of these people are looking to be surrounded by others with epilepsy. That is so empowering for them. Prep, yes, of course, structure is needed, but I don't think too much stress needs to be put on what the agenda for each discussion is going to be. It's a structured space. Yes, we have a professional in the room, you know, just helping facilitate discussion, but that's about it. The rest of it, I think the duration and the right group will set the right tone for the group. So that's, I would say, the learning that
And then
I've.
the key thing here becomes like, really mobilizing the ecosystem
Yeah.
where a lot more people talk about support group, talk about their condition, are willing to sort of give this a chance, are open to other formats of support. Plus, probably even doctors, neurologists, understanding what the possibilities are. So, like, I mean, assuming that we will really reduce barriers, it
Yeah.
will require a like the biggest challenge we foresee is outreach and how to really reach a scale where important stakeholders are thinking of emotional support as default when it comes to chronic conditions like epilepsy.
Absolutely, absolutely. I think that was something that we did come across. We spoke to so many neurologists, and very few happened to think that this is something that they must offer to their patients. It was like such a good to have thing for them, where they said, "Acha, oh, you're doing this. Okay, maybe we'll think about it." And this is when most people, I think, encounter patients who need support, and they're, I mean, they know that they don't have the time or the expertise to manage this. Yet there is no one-stop solution for these folks. So I think, yeah, I mean, definitely education at all levels needs to happen for the patients, for the all stakeholders need to be more aware.
So true.
Yeah.
Cool. So we'd wrap this now. Thank you so much for the chat, Pravina. It was very interesting.
Good talking to you, Mike.